Welcome back, future doctors. Today we are diving in some challenging mdcat MCQs to sharpen your knowledge. Let's get started. So the first MCQs is active thyroxine is also called a T1B, T2, C, T3 and D, T4. So the correct option is D, T4. The next MCQs is congenital under secretion of thyroxine causes A. Krabs disease, B. Myxedema, C. Addison disease, and D. Cretinism. So the correct option is D. The next MCQ is hormones involved in ossification of wounds. A. Calcitonin, B. Oxytocin, C. Thyroxine, and D. Parathormone. Parathormone. So the correct option is A. Calcitonin. The next MCQ is high level of TSH can be seen in all conditions except A. Stress, B. Growth, C. Brain differentiation, and D. High thyroxine level and blood. So the correct option is G. The next MCQ is brain cell falls to differentiate and A. Cretinism, B. Dwarfism, C. Krabs disease, and D. Addison disease. So the correct option is A. The next MCQ is metamorphosis in amphibian is under control of A. Sex hormone, B. Pituitary hormone, C. Thyroid hormone, and D. Parathyroid hormone. So the correct option is C. Thyroid hormone. The next MCQ is due to hyper secretion of thyroxine, there is increased DMR and exophthalmic goiter. And this occurs as Addison disease, B. Krabs disease, C. Cushing disease, and D. Diabetes disease. So the correct option is B. Krabs disease. The next MCQ is the deficiency of water, of which micronutrient causes goiter formation. A. Iron, B. Zinc, C. Iodine, and D. Sodium. So the correct option is C. Iodine. The next MCQ is action of parathormone is antagonistic to A. Insulin, B. Calcitonin, C. FCH, and D. TSH. So the correct option is B. Calcitonin. The next MCQ is underactivity of parathyroid gland leads to A. Diabetes, B. Dwarfism, C. Kidney stone, and D. Muscular tetany. So the correct option is D. The next MCQ is most portion of pancreas X is A. Endocrine, B. Exocrine, C. Um, Mesocrine, and D. Autocrine. So the correct option is B. Exocrine. The next MCQ is which of the following statement is incorrect regarding insulin? Inhibit glycogen hydrolysis, increasing glycolysis, C. Convert to protein, and increases lipolysis. So the correct option is D. The next MCQ is all are function of glucagon except A. Glucogenesis, B. Gluco, gluconeogenesis, and D. C. Lipolysis, and D. Protein synthesis. So the correct option is D. The next MCQ is major endocrine cell and pancreas are A. Alpha cells, B. Beta cells, C. Gamma cells, and D. Delta cells. So the correct option is B. Beta cells. The next MCQ is release of hormone from isolate of Langerhans is under the influence of A. STH, B. ACTH, and D. Blood glucose level, and D. All A, B, and C. So the correct option is D. The next MCQ is tumor and beta cell results in all except A. More insulin production, B. Low glucose in blood, C. Destruction of alpha cell, and D. Low calcium in blood. So the correct option is D. The next MCQ is the destruction of all beta cells and the pancreas causes A. Glucagon secretion to stop and decrease blood glucose, B. Glucagon secretion to stop and increase in blood glucose, C. Insulin secretion to stop and increase in blood glucose, D. Insulin secretion to stop and decrease in blood glucose, and E. insulin secretion will increase and a decrease in blood glucose. So the correct option is C. The next MCQ is alpha cell of pancreas secrete a hormone known as A glucagon, B gestatin, C insulin, and D renin. So the correct option is A glucagon. The next MCQ is which of the following is not secreted by thyroid gland? A tyrosine, B tyrosine, and D calcitonin, and D glucagon. So the correct option is D. Thanks for joining me. I hope these and MCQs help you sharpen your knowledge. Keep studying and stay tuned for more podcasts. Thank you and Allah Hafiz.